Hi everyone, I'm Erika Bennett with South Georgia Medical Center, and I'm here today with our President and Chief Executive Officer, Mr. Ronnie Dean. Mr. Dean, thank you for joining us.
Good morning, Erika.
And we are here in our Perlman Comprehensive Cancer Center, and it is beautifully decorated for the Christmas holiday. It's Christmas week.
It is. It's a beautiful place, and it's a healing place, and it should be decorated accordingly. Folks come here from all over the region of South Georgia, North Florida for healing treatments, and it's really a pleasure being here. The staff's done a great job of bringing the Christmas spirit into the Cancer Center.
And speaking of Christmas, we received a very special delivery yesterday. Do you want to tell us a little bit about that?
Well, we did. Many of you in public know by now, we have received our first shipment of the COVID-19 vaccine. It's the Pfizer COVID-19 vaccine. 975 doses were shipped. I'm proud to report that beginning yesterday at noon through about 8 o'clock last night, we vaccinated over 160 of our frontline healthcare workers, and today as we speak, we're continuing those vaccinations until we run out of the initial dose. Now, more good news is the Moderna vaccine has been approved and it is being shipped as we speak, and we're anticipating its arrival. And then Pfizer will be shipping more, and that'll help us finish vaccinating our 2,700 employees and the members of our medical staff that are here on site routinely. So it's a very exciting time. You know, Erika, I took it. I'm here. Somebody asked me today, actually a dozen or more said, "Hey, how you feel?" I said, "I feel okay. Yeah, I got a little shot in my arm, and it's sore, but no fever. I had to take no analgesics, no Tylenol. Don't feel any different today, and I'm looking forward to 21 days from now taking the booster dose." And you all know, you take 2 shots, one now, 21 days from now, and the efficacy, meaning the effectiveness of it, is about 95%. Now that's really good. It is indeed a Christmas present because the community, the state, the nation, and our healthcare workers that are on the front line, Erika, have been battling hard, and these employees, and those that have contracted COVID, the families. It's time for us to get to this point in time, and hopefully in time we'll get to a point where we won't have as much COVID among us. That's what we're looking forward to.
Absolutely. I know I had the pleasure of witnessing the first doses being administered yesterday, and also just seeing the doctors just come out to get theirs. They were extremely excited, and I think if the doctors are excited about it, that truly speaks volumes to the safety of it,
right,
and the way it's turning this momentum. So
well, it's the next line of defense, and I've said this before, and again, those listening in, it's a personal choice. It's not a requirement, but in time, I would hope more would choose yes. I'll take the vaccine. Vaccines have been around for a long time. They keep us from experiencing all types of illnesses. This is the next round of vaccine. The science behind this vaccine, I personally have studied it. I've listened to our experts talk about it, and it's been built the right way. It was built expeditiously on a fast timeline. But I would just encourage everyone, you do your own research, you talk to the person you trust the most, and you decide. And when the time comes for you to have the vaccine, you choose. It's your body, your life, your decision. But the truth of the matter is, I'm convinced that it's going to help us battle this terrible pandemic that's been plaguing us for many, many months now. So,
absolutely. And while this is wonderful news, we have seen the cases of hospitalized patients that are positive with COVID start to steadily kind of creep up. What are we seeing in the hospital?
Well, again, it's another reminder that the battle rages on. COVID-19 is highly contagious. It is among us, and we're even hearing about different strains in Europe. I'm not sure about that. Remember, I'm not a scientist, I'm an administrator, and I'm not going to speak to that. What I know is what it has done in our community and the impact it's having on our hospital, our healthcare workforce. Today, for example, we now have 63 inpatients at this moment in time. If you all remember, back in August, we had our high was 77 patients in a bed. 9 of the 63 patients, Erika, are on mechanical ventilators. And unfortunately, we are experiencing, again, high levels of mortality, although we're battling hard to make sure these folks get better and get to go home. You know, the vaccine is one line of defense. I'm very excited about another I'll tell you about. There is a drug, it's called a monoclonal antibody. You can research it. We are administering it on an outpatient basis to a number of patients that meet the criteria. So for example, if you are diagnosed with COVID-19 early, you come to our emergency room seeking help, or you go to your physician's office, if you meet certain criteria, your physician may prescribe you an infusion of this monoclonal antibody. And what this monoclonal antibody does is a protein that has been built to mimic the body's immune system, and that protein fights the virus. So it's been especially designed, it's been released, we're using a lot of it, and we think it's another great line of defense. As a matter of fact, it reduces hospitalization in certain patient types by 30 to 40%. So y'all might hear about that as if in fact you have a loved one or if you contract COVID as an option of treatment. But we continue to be on the front line of this thing, not only with monoclonal antibodies, but now with these vaccines. And I just really believe, everybody, that we're going to turn the corner very soon, and just encouraging everybody to get on board, continue to do the things we know, Erika, to keep from, spreading COVID-19.
Absolutely. Continue to wear your mask, wash your hands, watch your distance, especially as we embark on this Christmas holiday that may not look exactly like what we're used to.
That's right.
Just keep that in mind so that we can all stay safe and that we can keep these numbers down in a manageable way. Mr. Dean, we continue to offer the COVID-19 testing drive-through station at our Smith Northview campus. Can you give us an update on what we're seeing there?
Oh, I can. You know, that was probably one of the best things that we've done that's come alongside Department of Public Health and others that administer the testing and create a convenient drive-through. Out there, Erika, we think we're going to be there a while, so if folks are driving by, you'll notice that we've moved from tents to permanent structures to make it even more convenient and, better for our staff. They're out in the elements, so heating and cooling in the summer, heating in the winter, all of that, but we continue to operate it. We did expand the hours this past week because of the increase in demand. We had, I think we were open on Saturday and Sunday, and our schedule right now for this week is that we would be open half the day through noon on Christmas Eve. We would close it on Christmas Day, but we anticipate opening it again at least a half a day on Saturday and maybe on Sunday also. Y'all keep an eye out for bulletins and post online, and we'll let you know when it's open. We believe the sooner you can test if you have symptoms, sooner you can test, the quicker you can be treated. So we want to make that available to everybody. I think yesterday, Erika, we had a record 360 cars drive through. That's the demand on the center, and the positive rates are higher in the community, and you said it. And it's going to be very challenging, everybody, this Christmas not to gather up like we have in the past, but I really encourage you, think about it long and hard. Don't let your guard down. The community's done a great job. Let's try to protect each other. I'm taking measures to protect my 86-year-old mom, and other family members are doing the same thing. And the goal is to get past this point in time, and then we'll be back to some normal, I believe, Erika, and we can experience Christmas like we have in the past. But right now, we probably need to do some modifications to what it is we've done in the past, just to be safe.
Sure. And with 2021 approaching, I know everyone is excited to get out of 2020. Can you share any news of what might be happening in the organization come the new year?
Well, this has been a challenging year. What I'm most excited about is we're adding new team members. We have one of the finest healthcare workforces in the nation right here in Valdosta at South Georgia Medical Center. Our nurses, our respiratory therapists, our physicians, our environmental service teams, our food service team, our maintenance teams, our entire workforce are just ideally prepared for this moment in time. And what I would tell you is we're growing. We're growing that workforce, and we're really growing the number of physicians that are coming in. We added 19 physicians this past year to our staff. There is about another half a dozen coming between now and May, and we're going to announce those as they come. These are highly specialized physicians that will help us receive treatment at home. Demand is outstripping the supply of the physicians in the community and in the region, and our goal is to bolster that so you can have your treatment, your care, your services here at home so you don't have to travel. Very excited about next year and can't wait to start telling everybody by video about these new physicians. They're some of the finest in the nation that are coming to Valdosta, Georgia to help us care for our community. So very excited about 2021 for that reason.
Thank you everyone for tuning in, and we really want to take a moment to thank our healthcare workers and everyone who works throughout our organization. They have really proven to be true heroes this year.
They have, Erika. Let me just say this. Everybody, thank you for the cards. Thank you for the letters, the written comments, the spoken word. I thank you for the prayers, your thoughts for our team. And I just invite you during this time of year when many of us will get to be at home, just remember there are patients that will not leave this hospital through the holidays. Many of them will not have family members visit them because of the situation. And then there is a healthcare workforce and all of these essential frontline people that are coming together, and they'll be here when we're not, taking care of others that are in need. And y'all just lift them up in your thoughts and prayers, and that would be that'd be a real benefit to our workforce team. They're strong, they're willing, they're prepared, and they're committed. But it just helps them when they know we're thinking about them. And I just want to thank you for what you've done so far and ask you to do more.
Absolutely. Thank you everyone for tuning in, and we hope you have a very wonderful Merry Christmas and a Happy New Year.